How to remove fluids out of the lungs. Fluid in your lungs turns something automatic into something exhausting. You feel short of breath climbing stairs you normally handle with ease. Your chest feels tight. A cough that won't quit shows up out of nowhere. This isn't just discomfort. It's your lungs telling you something has gone wrong with the way they move oxygen into your blood. The science behind the buildup. Your lungs rely on tiny air sacs called alveoli to move oxygen into your bloodstream and push carbon dioxide out. This exchange happens with every breath, thousands of times a day, without you noticing. Pulmonary edema disrupts that exchange. Fluid leaks directly into the alveoli, and oxygen struggles to pass through. The result is lower oxygen levels and a body working overtime just to breathe. Pleural effusion works differently. Fluid collects in the pleural space, the thin layer sitting between your lungs and your chest wall. It sits outside the lung tissue, but it still presses in on your lungs and blocks them from expanding fully. What's actually causing it? Heart failure is one of the most common triggers. When your heart can't pump blood the way it should, pressure builds inside the blood vessels of your lungs. That pressure pushes fluid straight into your alveoli. Infections play a role too. Pneumonia inflames lung tissue and ramps up fluid production, flooding spaces that should stay clear. Your kidneys matter here as well. They're built to clear excess fluid from your body, so kidney disease often means fluid has nowhere to go. Severe lung injury, inhaling toxic substances, trauma, and conditions like acute respiratory distress syndrome can trigger the same buildup, even without heart or kidney problems involved. Signs your body is sending a warning. Shortness of breath, rapid breathing, wheezing, chest tightness, and fatigue are the most common red flags. Some people develop a cough that brings up frothy or pink-tinged mucus, a sign strongly linked to pulmonary edema. Others notice swelling in their legs or ankles, especially when heart failure is behind the fluid buildup. None of these symptoms belong on a weighted-out list. Catching them early changes outcomes. How doctors clear the fluid. Diuretics are usually the first line of defense. They push your body to produce more urine, which pulls excess fluid out of your bloodstream. Less fluid circulating means less pressure in your lungs' blood vessels, which gives the fluid trapped in your alveoli room to clear. Oxygen therapy steps in when your blood oxygen drops to unsafe levels. Depending on how serious your condition is, oxygen might come through a simple nasal cannula, a mask, or a more advanced respiratory device. For more severe cases, non-invasive ventilation methods like CPAP or BiPAP apply gentle pressure to your airways. That pressure helps push fluid out of the alveoli and reopens areas of your lungs that fluid has been crowding out. When fluid needs to be drained directly, sometimes medication and oxygen aren't enough, especially when fluid has built up around the lungs instead of inside them. That's when procedures step in. Thoracentesis involves a healthcare provider guiding a needle through your chest wall into the pleural space to draw fluid out. Beyond relief, the fluid gets sent to a lab, which helps identify whether infection, cancer, or inflammation is behind the buildup. For fluid that keeps coming back, a chest tube offers continuous drainage over time instead of a single removal. For recurring pleural effusions, pleurodesis takes it a step further, introducing a substance that causes the lung and chest wall to stick together and eliminate the space where fluid collects. Treating what's causing it. Draining fluid only solves half the problem. The underlying cause needs treatment too. Heart failure calls for medications that strengthen heart function and ease blood pressure, reducing strain that leads to future fluid buildup. Infections like pneumonia get treated with antibiotics or antivirals to knock out the source of inflammation. Kidney-related fluid overload might call for treatments that restore kidney function or dialysis to remove fluid the kidneys can't clear on their own. In the most severe cases, patients need mechanical ventilation. A ventilator takes over some or all of the work of breathing, keeping oxygen levels stable while giving damaged lungs time to heal, lowering your risk going forward. If heart-related pulmonary edema is part of your history, Cutting back on sodium helps prevent fluid retention before it starts. Staying active within what your doctor recommends, keeping a healthy weight, and sticking to your medication schedule all lower your risk of another episode. Regular checkups matter most for anyone managing chronic heart or lung conditions, since they catch fluid buildup before symptoms turn severe. What recovery actually looks like. Some people bounce back fast once fluid is drained and the underlying cause is treated. Others, especially those managing chronic conditions, need ongoing monitoring and care. Either way, early diagnosis changes the trajectory. The sooner fluid in the lungs gets identified and treated, the lower the risk of lasting lung damage. Respiratory therapists carry a lot of this work. They track oxygen levels, run respiratory therapies, assist with procedures, and walk patients and families through what chronic conditions mean day to day. Their work behind the scenes is a big part of why outcomes keep improving. Fluid in the lungs sounds alarming, and it can be serious, but it's rarely a dead end. With the right treatment, timely diagnosis, and follow-through on lifestyle changes, most people recover and get back to breathing the way they're supposed to.